From the American Neurological Association, I'm Adeline Goss. This is ANA Investigates. Neurologists bring an important perspective to health policy, but few of us have formal training in how to advocate for our patients at a state or national level. Our guest today, Dr. Kara Stavros, is an associate professor of neurology at the Warren Alpert Medical School of Brown University and the president of the Rhode Island Medical Society. She's also a self-described advocate who's found a number of ways to speak up for her patients and influence health policy. Dr. Stavros spoke about her path to advocacy with Dr. Sarah Nelson, assistant professor of neurology at Tufts Medical Center. Here's Sarah.
Kara, welcome to the show.
Thank you so much for having me, Sarah. It's a pleasure to be here.
I guess to level set, what are we really talking about when we're discussing advocacy here?
So advocacy can be defined in multiple ways. Generally speaking, it's lending our support to an issue. But I think that for us as neurologists, it involves using our professional work and expertise to try to support our patients and our colleagues and help create meaningful change.
The first question I had for you was to learn a little bit more about how you became interested in advocacy work.
I think I first became interested in advocacy early on in my career. Admittedly, advocacy wasn't really on my radar when I was a medical student or a resident or a fellow. But after I started working as an attending, I started to become more aware of patterns or recurring issues and the care that I was providing for patients and some of the barriers that I was seeing patients face. So, for example, affordability of medications and the consequences of that in our patients' lives. And I think, like many of us, there were times when I felt the need to advocate for my patients on the individual level in order for them to get the best possible care, the best possible treatment. And so I started to develop an interest early on when I started in practice. And I think in the first year or two after I started as an attending, I saw a print advertisement for the AAN's Neurology on the Hill. And I thought that might be something I'd be interested in. So I ripped it out of the newsletter and went online and applied. And I was very lucky to be accepted that year. And the experience that I had at Neurology on the Hill was really transformative. If you're not familiar with Neurology on the Hill, this is a yearly event that the AAN does where they recruit neurologists from all 50 states to apply to come to DC and provide advocacy training on issues that are current and impacting neurologists and patients with neurologic conditions. And then all of the advocates meet face-to-face with lawmakers on Capitol Hill to talk about these issues and the critical role that neurologists play in healthcare. And so I learned a lot about what it meant to be an advocate as a neurologist and made lots of connections with other advocates, and I had a lot of fun doing it too. So I came out of that experience fairly determined to do more and went on to kind of intentionally seek out other opportunities to get involved. I went on to join my state neurological society and then my state medical society as a representative of the neurological society, and found a lot of opportunities to get involved there and learn about how advocacy works on the state level. And it kind of put me on the leadership track within the medical society as well.
How has your journey in neurology advocacy evolved over time?
It really has evolved over the years. And I think an important part of my journey, honestly, was another program actually through the AAN, the Palatucci Advocacy Leadership Program, which they call PALF. I graduated from the program in 2018, and I've really benefited from my involvement in that program, which helped give me a lot of direction and focus to my advocacy efforts. PALF is really an excellent tool that helps provide neurologists with skills to create effective action plans for an advocacy initiative, to build coalitions, to just become a more effective advocate. But you also get a lot of training in communications and media training, leadership skills. And I really through that program, became part of a community of advocates. And it made me really want to share what I learned with others. So I think that helped give me a lot of direction in my advocacy journey. And, over time, I think a lot depends on what issues are impacting our patients and our field the most at a given time. Although there are certainly some issues that are definitely more longstanding challenges, like the high cost of prescription drugs, for example, in neurology. But I generally tend to look towards organizations like the AAN or my state neurological or medical societies to help guide me towards what are the most pressing issues so I can grow my knowledge in those areas. And I think that, as an individual, it can be really hard to keep track and stay up to date when you're busy doing full-time clinical work or research. So leaning on these organizations to help you stay informed is really, really helpful. And I think that one of the bigger projects that I've kind of been invested in along this journey has been my interest in supporting residents and fellows who want to get involved in advocacy. I think that definitely neurologists who have built a knowledge base in public policy and advocacy can serve as better advocates for their patients and for themselves. But certainly that sort of more formal training is not typical in medical school or in residency. So, one of the projects that I worked on was creating an advocacy education curriculum for at my institution and through other channels to provide that kind of education to students and to residents to help them prepare for their future careers when they will need to know how to successfully advocate for patients and understand how health policy affects their patients' lives.
No, that all sounds great. Are there particular issues, actually, Kara, that you feel like you've been particularly passionate about over the last few years or since you started your advocacy work?
I would say that one that's close to my heart is trying to promote education and advocacy skills amongst our residents and our fellows so that they become familiar with this early on and can develop skills that they then carry into their future careers and hopefully stay involved in advocacy going forward. So that's been one that as I said, is close to my heart. And generally speaking, I've done a lot of my advocacy involvement through the American Academy of Neurology and through at state level through the Rhode Island Medical Society, which is the state society that's more active in advocacy in our state. And so that's been sort of the focus of a lot of my efforts.
How do you decide when it's best to advocate on like a local level or, state or federal level? Do you have some examples where you kind of advocated in those different situations?
Gosh, yeah, you're right. The scope of advocacy, it really does vary. It can vary all the way from the individual or the patient-centered level to organizational or local to state to national, even global scale advocacy. So I guess a few examples might be, local advocacy is incredibly important. This is advocacy we all do within our own communities or organizations. And that could be something like participating in a local health fair or a Brain Week event. It could be interviewing the local media, for example. State advocacy is something that I think is also really key because a lot happens at the state level. And so this might include joining your state neurologic or medical society, maybe giving testimony, whether written or in person on state legislation. And there can certainly be some overlap between state and federal advocacy issues, but lots of differences too. I think with one important point being that policy tends to move a little quicker at the state level compared to the federal level. And so there is a real opportunity to make an impact right at home. Some of the issues, as an example, that may be more active at the state level might include issues like scope of practice, for example, or efforts to strengthen the neurology workforce or utilization management issues like prior authorization or step therapy protocol reform. We've actually had neurologists in our state testify at the state house in the past for bills proposed for reform for step therapy.
One other question I have, that might be of interest to people listening to this podcast. How do you, balance advocating on behalf of neurology, yet, trying to also avoid getting too involved in politics?
I think the most important thing there is to really remember that we're advocating on behalf of our patients and the profession. And so we always want to bring our message back to that and remember that this is about the patients, their health, and their lives. And so sometimes there may be a lot of change or volatility happening. And it's all the more important to stay focused on the issue that you're advocating for and trying to keep the focus on your message, the message that you're trying to get across. So that may mean that sometimes you need to try to pivot the conversation back to what's really important. And I think overall, it's really important not just to show your passion, but to stay professional. And that's another key thing to remember.
Thank you. Yeah, that totally makes sense. How do you think academic institutions look at this type of advocacy work?
Well, I think it looked upon favorably, or I hope it is, and I think it's becoming more and more a viable career path in academics. It may not be a formal track such as a research track or a medical education track, but certainly getting involved in advocacy will afford you with opportunities to make important connections and gain skills that will absolutely help you advance your career in academics, I think. There's even a small literature out there on how to document some of these types of advocacy activities into an advocacy portfolio. And you could absolutely put these types of involvements on your academic CV to show the breadth and the impact of the work that you're doing and demonstrate the value. There may even be an avenue towards publication of a particular project, advocacy related project that you're doing, depending on your interests, which of course is always helpful as well in academics. And, I think that speaking more generally, we often think of advocacy as work we're doing on behalf of others, but there are so many benefits to the advocate on a personal level that are so important for professional development and for personal growth. And so things like cultivation of leadership skills, honing communication techniques, networking, even helping reduce burnout, all of these things I think are things that you can attain through advocacy work. I guess one more thing I would add, if I can, is, whether you're still in training or already in practice, we all have different mentors for different aspects of our career, maybe a research mentor, a kind of a work-life balance mentor, et cetera. But I think identifying an advocacy mentor can actually often be sometimes quite useful. Somebody who maybe you have found to be successful as an advocate or whose efforts you admire and could serve as a great resource to you, even if they're not someone who's working on the exact same issue as you.
That totally makes sense, and couldn't agree with you more that participating in advocacy efforts really does help hone your public speaking skills and communication, so forth, which are definitely very important skills overall. How do you choose kind of what to work on with regards to health policy and advocacy?
I think it all really depends on what you're passionate about. Sometimes that might align with a particular research interest or a clinical or an educational interest that you have, and it really grows out of the work that you're already doing, oftentimes, or maybe you have a personal interest in a particular area. I think just in generally speaking, neurologists are really, really well poised to be good advocates. We can share firsthand experiences within the healthcare system. We can attest to times when patients were affected by policy, and we can sense patterns that might indicate a larger issue at hand. And so a lot of what we do, even just day to day and routine patient care, it depends upon us advocating for our patients to access what they need, the resources, the treatment, the respect that they need. And so I think that many times, I think neurologists might find that they're already involved in advocacy work just in the course of completing their day to day work. So taking that next step and further engaging in some more formal advocacy activity, I think is really important in taking the knowledge and the skills that we bring to the table forward.
Yes, one other question, Kara, that I have for you. What sorts of resources can neurologists go to if they want to continue their journey within advocacy?
So I would definitely, from my own experience, I would highly recommend Neurology on the Hill and PALF that I mentioned earlier. I think these are extremely beneficial programs that give an excellent background on advocacy in general, but also current issues, and they're appropriate for anyone, any level career in your career, and both brand new to advocacy or more experienced advocates will get a lot out of those programs. And I also really do think that getting involved at a state level in whatever way is feasible for you can be really impactful. But if your time is short, and it may be you may have very little time to invest if you're, for example, still a resident and have a very full schedule. There are little things that you can do, like sharing information on social media to stay connected to an issue, or reading the AAN's Capitol Hill Report, which is a bi-monthly newsletter on advocacy, or responding to their action alerts, which help you to contact your lawmakers using very few clicks in a preformed email. So whether you have very little time or more time to devote, there's lots of ways to get involved.
Thank you so much, Kara, for being on the program today. We really appreciate your relaying to us your interest and how you became involved in neurology advocacy.
Thank you, Sarah. It's been a pleasure.
That was Dr. Kara Stavros of the Warren Alpert Medical School of Brown University, interviewed by Dr. Sarah Nelson of Tufts Medical Center. ANA Investigates is the official podcast of the American Neurological Association. The show's producers are members of the ANA Education Innovation Committee, chaired by Michelle Johansson. I'm Adeline Goss, podcast host and executive producer. Our production team this month included Sarah Nelson and Jen Hurley. You can listen to past episodes of the show, subscribe to us so you never miss an episode, and access all of the ANA's educational programs on the Education tab at myana.org. That's it for ANA Investigates. See you next month.